Good evening, everyone. I'm Mayor Andy Shore. Thank you for joining us for this important community update to discuss the next steps with our racial justice and equity process for the City of Lansing. Last year, the murder of Mr. George Floyd spurred a national call for police reform and a review of policies, practices, and procedures within government, the nonprofit, and private sectors. This horrific event reemphasized the need to have an honest dialogue to address racism and its impact on communities of color. In response to concerns raised here within the Lansing community that were consistent with the concerns that were raised throughout the nation, we took immediate action to begin listening and empowering people. Sorry about that. We took immediate action to begin listening and empowering people and organizations to help the city gain a better understanding of the disparities that exist so that we can work together to develop a strategy to achieve sustainable change. The first step we took was to launch a community-wide discussion to identify issues and to start to formulate action. As part of this process, we created and named community members to the Mayor's Racial Justice and Equity Alliance, or MRJEA. We needed to have an open and honest dialogue with the community about policies, practices, and procedures that have been examined and changed to address police practices and the perceptions of race issues in all city government. My administration and MRJEA listened to and heard from those who wanted to share their thoughts, ideas, and experiences. We also listened to and thoughtfully considered criticism and challenges. We really appreciate the valuable input received from everyone. It was through this type of exchange that we sharpened our focus and remained on course to create a solid plan of action for our city. Over the past year, MRJEA worked to combine your input, ideas, and suggestions and experiences with their additional research and ideas to create a detailed report. The report contains key issues and recommended strategies and actions that MRJEA believes will lead to positive change. Before accepting the final report as a blueprint for the final city's actions, we want to hear from you, the members of the Lansing community, once again. That's why I asked MRJEA to convene a meeting this evening to share their recommendations with you and to receive additional input from you and to answer any questions you have before the report's finalized. Once finalized, we'll be working on implementing the recommendations. Please know that the Racial Justice and Equity Report and the actions recommended are the beginning of our forward path to positive change. This forward action is about you, the Lansing community. It's about our present day Lansing and the future of our community. It's about our children, our grandchildren, and generations to come. And to be successful, we need your continued input and support tonight and in the future, even after we release the final version of this Racial Justice and Equity Report. As your mayor, I know that we can grow by listening and learning from each other. This meeting will make sure that we're listening and growing and making sure that we have the best atmosphere here in the city of Lansing for everyone. Moving forward together, we'll build a stronger foundation that will last far beyond us and will create the positive change for the city that we love. So thank you once again for joining us tonight. At this time, I want to introduce Teresa Bigman, the city's expert consultant for this process, who will provide an overview of tonight's events. Teresa?
Thank you, Mr. Mayor. We appreciate your leadership, support, and high expectation of excellence in all that we do to advance a community-inspired and community-driven plan of action to address racial justice and equity in the city of Lansing. As Mayor Shore stated in December 2020, when issuing Executive Directive 2020-03, which addressed the city of Lansing's commitment to fair and bias-free treatment of all people, and I quote, "Research reveals that implicit bias impacts everyone and further affects the delivery of governmental services. As a result, we know that it is the consistent responsibility of city government to marshal policies and procedures that root out, expose, dislodge, and ultimately correct implicit biases and structural racism. Public servants must reflect and translate their democratic ideals by placing racial equity and the elimination of bias at the forefront of city policymaking and action. Changing the landscape regarding bias in our community will require everyone's efforts, but as city government, we must take the lead," unquote. To everyone gathered here this evening and to everyone who has been involved in this process, we thank you. We thank you for your input and we thank you for your support. In addition to the many people who live, work, and visit Lansing, we want to thank our collaborative partners which include the City of Grand Rapids, Michigan, the City of San Antonio, Texas, the Government Alliance on Race and Equity, which is GARE. May we have the next slide, please? The National League of Cities Race, Equity, and Leadership Program, the Michigan Department of Civil Rights, and the Michigan Public Health Institute. Together, the Lansing community, City of Lansing public servants, and our collaborative partners have informed the Mayor's Racial Justice and Equity Alliance in a manner to ensure that we developed a racial justice and equity best practice right here in Lansing, Michigan. Thank you to everyone for sharing your advice, guidance, and valuable information. Our work would not have been complete without the help of each of you. Thank you once again for sharing your advice and wisdom. Tonight, we will share key highlights from the final Mayor's Racial Justice and Equity Alliance report. We will hear from co-chairs of the MRJEA, Kimberly Coleman, the city's Director of Human Relations and Community Services Department, and Police Chief Dr. Darrell Green, the co-chairs of the MRJEA. Chief Green will provide an overview on the external input that the MRJEA received from you, the members of the public, through an electronic survey and a series of focus group meetings with community organizations. Could we display the next slide with the agenda, please? We will also hear from Dr. Paul Elam, the Chief Strategy Officer for the Michigan Public Health Institute, who will provide an overview of the internal scan that was conducted within City Hall. We will then hear from Guadalupe Ayala, the city's first Diversity, Equity, and Inclusion Officer, who was appointed by Mayor Shore in November 2020. She will share the issues and goals that were identified by the MRJEA committees. Tomorrow, we will provide to each of you a longer version of the results of each committee's work so that you can see the strategies and the details relative to the issues and goals that they will share with you and discuss tonight. This detailed document will also appear on the city's webpage that's dedicated to the racial justice and equity work. As you engage the chairs of the MRJEA committees during a panel discussion this evening, please feel free to ask questions and provide additional input. Committee members have worked very hard and they have put forth strategic and thoughtful recommendations based on their expertise, as well as the input that you, the members of the public, have shared. It is our expectation that the city's racial justice and equity plan becomes a long-term solution to issues that have existed in the city for many years. It is our goal for this plan to become an integral part of city government for now and into the future. Therefore, we urge you, the members of the community, to remain informed and to remain involved in the action to ensure longevity of the racial justice and equity plan, and to also ensure accountability for everyone involved in city government, including current and future leaders. Thank you for joining us this evening. I will now turn the program over to our facilitator and the co-chair of the Mayor's Racial Justice and Equity Alliance, Director Kimberly Coleman. Kim?
She may be having technical difficulties with her sound. She will be trying.
Kim, it looks like your microphone is off. Do you have the volume turned up on your computer? You do have the volume turned up. Could you maybe not connect with your Bluetooth device and just use the regular speaker? That might get you into the conversation. we're not able to hear you. So perhaps what's happening is that your Bluetooth device that you wanted to use to ensure you had great audio is still connected to your computer. If you could turn off the Bluetooth and see if that will work. Okay, thank you.
Hey, Kim, the triangle down by the mute and unmute, you can change which microphone you use. So choose a different microphone there.
Can you hear me now?
You can.
Awesome. My sincerest apologies. Thank you, Teresa, and everyone for your patience. Good afternoon, everyone. It has indeed been my honor and my privilege to serve as co-chair of the Mayor's Racial Justice and Equity Alliance, along with Chief Darrell Green. Tonight, we're pleased to share with you highlights of the plan that has been developed as a result of your input and under the leadership of the Mayor's Racial Justice and Equity Alliance. We would like to take this time to acknowledge the members of the Mayor's Racial Justice and Equity Alliance and thank each of you for your thoughtful work. MRJEA members, we appreciate you for sharing your time, your talents and skills, and for adding the community's voice and direction into your process. For that and more, we thank you. We have accomplished much since last July after Mayor Schor released the Racial Justice and Equity Community Action Proposals. We're pleased to report that all items identified as immediate action have been fulfilled, which include signing the 8 Can't Wait pledge, signing President Obama's mayoral pledge. We initiated the Diversity, Equity, and Inclusion Plan. We finalized the Diversity and Inclusion Officer's position in the city. We built a centralized transparency resource on the city's website. We implemented training in the mayor's office to include normalizing racial equity in local government and implicit bias training. We conducted police reconciliation training. We adjusted LPD traffic stop policy by prioritizing in order to lessen secondary violations that have little or no impact on public safety. And we adjusted LPD's policy prohibiting no-knock searches. Also, all items listed as the next steps in the mayor's community action proposals have been accomplished. We've conducted 6 town hall listening sessions, including tonight, to receive input from the public and to share the Mayor's Racial Justice and Equity Alliance updates. This includes budget review with the community regarding resource allocation for enforcement, community services, and social safety net. We conducted police use of force community conversations, which were held by the Board of Police Commissioners. We've also conducted an internal scan led by Michigan Public Health Institute and an online survey for the public. And just so you know, 10 of our community-based partners have facilitated focus groups to obtain additional information and public input. In addition to these accomplishments, the Mayor's Racial Justice and Equity Alliance members have developed strategic plans for each of their committees, also called work groups. And on May 31st, we submitted a draft Racial Justice and Equity report to the mayor and will soon begin to implement a long-term racial justice and equity plan. Despite all that's been done, please know that your continued support, input, and participation is needed, and we look forward to receiving your input tonight. So please share your comments and questions in the chat box that's located at the bottom of this Zoom screen. We will monitor your input and we'll do our very best to respond to each question. At this time, I would like to introduce Dr. Paul Elam. Dr. Elam is the Chief Strategy Officer for the Michigan Public Health Institute. He, and along with his team of diversity, equity, and inclusion experts, conducted an internal scan of the city's operations. Dr. Elam will share highlights of their findings with you, along with recommendations that have been approved by the Mayor's Racial Justice and Equity Alliance. I present to you Dr. Paul Elam.
Thank you, Kim, and good evening, everyone. My assignment is to share an overview and some highlights of the City of Lansing's internal organization scan that MPHI completed on behalf of the City of Lansing. A little bit about MPHI. Just wanted to let you know that we were formed under Michigan state law in 1989, and we have been an integral partner in bringing together governmental, academia, community-based organizations, and healthcare providers to advance health equity and social justice within the state of Michigan. And we really feel that we are empowered and positioned to help develop solutions to a wide range of challenges to ensure the health and well-being of all of the citizens that reside within our state. In January of 2021, the City of Lansing, Office of the City Attorney, contracted with MPHI to conduct an organizational assessment for the City of Lansing. And the purpose of this scan was to identify race-related issues associated with diversity, equity, and inclusion within City of Lansing departments, as well as throughout the entire city as a whole. And this was based on Mayor Shore's executive directive aimed at fostering the fair and bias-free treatment of city employees. The goal of this internal scan was to gather a wide variety of data regarding the perceptions and working experiences of employees across various City of Lansing departments. And the goal was to make sure that findings and insights were shared with the City Attorney's Office as well as MRJEA as evidence to help make data-informed decisions to create a diverse, inclusive, and welcoming environment for all employees. Our work was completed in 3 phases. It started, as I mentioned, in January of this year. We initiated focus group sessions with employees throughout the city to identify challenges, opportunities for growth, and areas of success based on their lived experience. Phase 2 was initiated, which included a document analysis to look at policies, procedures, practices within the City of Lansing and respective departments. And we wrapped up the work in phase 3 with an organization-wide survey. Several questions were probed throughout this work. One overarching question, which looked at employees' perceptions of race relations within City of Lansing departments and the city as a whole. We also wanted to ask questions about employees' perceptions of the mayor's race-related initiative. We wanted to dig a bit deeper to find out what employees felt about diversity, equity, and inclusion within the City of Lansing, and also if employees had perceptions of any differences in treatment based on race and in some cases, gender. The last question probed around recommendations that employees wanted to make sure that the environment was more diverse, equitable, and welcoming from their perspective. Concerning question 1, how employees felt about the City of Lansing's initiative led by the mayor, we did find that most employees were aware of the initiative, about 60%. 40% said that they were not as aware, and others felt that they were very knowledgeable about the work if they were sort of in a leadership position. And so one of our findings was we're on the right path to actually communicating this work, but we wanted to make sure that we had additional effort to share this information throughout all the ranks within the City of Lansing. Our next question around employees' perceptions of diversity, equity, and inclusion within the City of Lansing. We really probed in that with our survey as well as the focus groups, and want to talk a little bit about diversity first. You should know that currently there are about 900 staff who work at the City of Lansing. 70% of them identify as white, about 17% Black, 16% Hispanic, and 2% Asian or Pacific Islander. So that's the current state. When we asked employees about their perspectives regarding this diversity, many employees felt that the City of Lansing lacked diversity and was majority white and male dominated, and felt that there should be efforts taken towards increasing diversity amongst BIPOC staff, that's Black, Indigenous, staff of color. The second thing we found with there was mixed perceptions of diversity between white and BIPOC employees. Depending on who you asked, people responded a bit differently. And so we want to make sure that we're very clear about the target that we're pursuing throughout this mayor's initiative. And lastly, in terms of diversity, a key finding was the perceived diversity by members of leadership team within their respective department was seen more favorable at leadership levels. And so leaders tended to think that diversity was better than staff who actually worked under their leadership. So a couple themes there about diversity as it relates to where we currently are and where we would like to be. Perceptions around equity. 4 themes emerged in this area. Staff felt that there were some inequitable employment work-related practices based on race and or institutional connections. And so depending on where they were situated and how others were perceived to actually have access to promotions, access to grievances, or access to opportunities, there seemed to be some inequitable opportunities based on the perceptions of employees. The second thing was there were mixed perceptions related to equity amongst BIPOC employees. That's sort of just having conversations amongst Black, Indigenous staff of color. They didn't necessarily agree themselves on if the city was actually equitable or not. So depending on who you were, where you were situated, we cannot emphatically state that people of color feel one way as a group. And so there's diversity amongst BIPOC staff when you ask this particular question. The third thing was there were mixed perceptions regarding equity based on biological sex. So even though this study did not attempt to disaggregate concerns by sex, many of the concerns that were raised shared concerns around sex. And so when we look at issues related to equity, many times we heard that there was not perceived equity across gender as well as race. And then finally, we saw that there was perceived inequitable handling of reported grievances. From the perspective of employees, they felt that there could be a bit more transparency, a bit more clarity on why certain grievances were being dealt with and why others weren't being dealt with. The next area focused on inclusivity. There were 5 themes that we found in this area. The first being lack of cultural awareness and sensitivity. Employees overwhelmingly thought that we needed to spend more time doing the types of trainings related to unconscious bias, issues related to race, diversity, and equity to make sure that supervisors and staff had a greater level of awareness and sensitivity due to the multicultural staff that actually work within the city of Lansing. The second theme was there was lack of efforts to be inclusive. And so when we looked at experiences from department to department, staff were able to articulate what they experienced in some departments that they felt was inclusive behavior versus other departments that might not have felt very inclusive, and really wanted to see that that was experienced across all the departments within the city of Lansing, and that leaders were on board with providing that type of inclusive environment. The third theme is the environment was not perceived to be welcoming at all times. Again, these are perceptions based on different cultural backgrounds, different racial backgrounds, different gender backgrounds, LGBTQIA plus self-identification. Staff felt that we could be more sensitive and welcoming to the diverse groups that work within the city of Lansing. Fourth, there was mixed perceptions regarding feeling heard and having a voice. And so some staff felt that they did have access to supervision, to human resources, even to the mayor's office to share voices or concerns, and other staff did not feel that way and felt that there needed to be more opportunity to participate in experiences like these where they could show up, respond to a survey, have a one-on-one interview, or even participate in the focus group to share their perspectives. And then lastly, as I mentioned earlier, there is some perceived sexism, not only raised by females within the city of Lansing, but many male employees also identified concerns that they had around issues related to sexism. What were some of the barriers to advance inclusion within the city of Lansing? And two themes emerged here. There's a term that's around called cancel culture, and that really means that when employees are silenced or dismissed if they do not agree with something or someone, particularly leaders. And so we heard a theme that employees felt that if they pushed against the grain, raised some things that might challenge leadership or raise some concerns that they have, that they were canceled. Their voices were minimized and they were ostracized. And then the next piece was lack of consistent leadership. In some of our departments, we've had turnover, and it precludes employees from developing trusting relationships with those supervisors to help work towards the goal of inclusion. So concerning those three areas, diversity, equity, and inclusion, there were several findings. One of the final questions we asked was there any difference in your perceptions of how different racial groups were being treated as you look at how people interact day to day when they come to work? And two themes emerged here. There were mixed perceptions that employees were treated differently based on their race. Again, we really didn't find a common response within racial groups. So white staff and BIPOC staff had different perceptions around this. Some felt that we were doing very well. Others felt that we could improve. And then the second thing was there was a perceived lack of interaction between individuals from different racial groups. Tended to be siloing. And so staff felt that white staff tend to spend more time with staff who look like them, and BIPOC staff tend to spend more time and feel more comfortable socializing with staff who have similar race and ethnic backgrounds. And so what can we do about this? We asked staff, what would you suggest we do to address these concerns that we identified related to diversity, equity, and inclusion? And they came up with many recommendations that have been consolidated into 13 concise statements here. The first is improve our hiring process and expand reach to recruit more diverse individuals. The second was to improve communication between employees, leadership, and the community as a whole around issues related to diversity, equity, and inclusion. Third, make diversity a priority and not a selling point. That really means that we want to see it, and we also want to take action on it. So many of us say, walk the talk and chalk the talk. We want to see things written down and codified in our documents to demonstrate that there's a priority. Number 4, focus on equity within departments. There might be a focus on the entire city as an institution, but there should also be a focus at the department levels where employees show up and work day in and day out. 5, create a safe space for DEI conversations like these. Staff really want to continue to engage in dialogue around diversity, equity, and inclusion. 6, host social events for all employees. People believe that there's healing work to be done, there's learning to be done with one another, and there's opportunity to come together and co-create solutions. 7, improve transparency regarding general operations and grievance processes. Make it clear from the perspective of employees why certain things move forward and why other things might not be dealt with. 8, acquire leadership buy-in regarding DEI initiatives. That really speaks to making sure that every leader understands the mayor's goals and is working towards supporting those goals around DEI. 9, retain existing programs. There was a lot of mention of successful programs that have been implemented within the city, but may not be currently in place due to the lack of state and or federal funds. 10, invest in employee capacity to enhance knowledge about DEI, making sure we have ongoing workshops and professional development opportunities and the like. 11, increase DEI and general job-related training offerings, which is really tied to number 10. 12, address need for standard job-related policies. We want to make sure that current policies are aligned with the goals of MRJEA. And then lastly, implement employee performance evaluations. There's an expectation that DEI aspects be included in performance evaluations, and that staff and supervisors have a conversation about those issues at least annually. Last slide here is, what are we recommending as an organization who conducted the internal scan? And based on what we saw in the document review, the focus groups that were conducted, and even listening to the feedback from the recommendations that employees made and looking at survey data, we came up with 9 recommendations that we believe address our multi-pronged approach. The first 2 are looking at a set of institutional changes that we would recommend be codified. Propose a charter amendment to establish language in the city charter to appropriate DEI funding each fiscal year to implement racial justice and equity strategies for the city of Lansing. And that is to deal with the ongoing need to prioritize and fund work that started this fiscal year. The second recommendation is to propose an ordinance amendment to establish a permanent DEI board to work with the City of Lansing diversity officer to implement a DEI plan. And so we want to continue to support what the mayor started by ensuring that there is a board that's in place to monitor and provide feedback on this work over time. The third is to appropriate funding to implement the mayor's racial justice and equity strategies for the City of Lansing this fiscal year so that the work can get started. Number 4, establish a commitment to DEI by setting a tone at the top that starts with the mayor himself. And this tone should be reflected in the city's vision, the mission, the strategic plan, our recruitment processes, our hiring processes, and onboarding processes to make sure that any new employee that comes to the City of Lansing hears and feels and sees what it means to work towards diversity, equity, and inclusion in terms of how they're recruited, onboarded, and socialized within the department that they work in. 5, establish citywide and department level DEI action plans and monitor the implementation of the plans. We're not assuming that every department will work on the same strategy or tactic, but we're assuming that every department will have a real plan to demonstrate that they're working towards some element of diversity, equity, and inclusion. 6, we want to charge the Human Relations and HRCS department to review, modify, and institutionalize all departmental policies, procedures, and practices, and ensure that they align with the mayor's core values and executive directive to advance DEI. Number 7, engage in employee outreach and education to improve the awareness of policies, procedures, and practices. We really felt that employees who might have perceived that things were being swept under the rug or not being addressed might need to understand what a grievance process really looks like so that they're clear about that, and we're more transparent about sharing that information with employees. Last 2, identify, fund, and implement DEI professional development, training, capacity building offerings, not only for staff, but administrators, managers, supervisors, to make sure that it's embedded in the onboarding and continuous improvement of staff as they continue to work at the City of Lansing. And lastly, we're encouraging that a diverse group, a diverse team be pulled together to discuss these 8 recommendations and to develop an action plan to implement these recommendations. I know that was a lot, but I only had 15 minutes, wanted to make sure we got through to it. And I believe Kim would like to open the floor for questions.
Thank you, Dr. Elam, and you're correct. Those of you who might have questions for Dr. Elam, please use the chat box below on your Zoom screen and put your chat and your questions in the chat. We've got one question here, Dr. Elam. And it reads, based on the information gathered, is it your sense that this is a new concern, or is it an ongoing or historical concern?
That's a great question, and I'll answer that in two parts. The employees that participated in the internal scan, either through a focus group or a survey, indicated that they had worked at the City of Lansing anywhere from 6 months to 24 years. And based on the responses from many of the employees who participated, who've worked here for at least 24 years, indicated that these are not new concerns, that from their perspective, issues of diversity, equity, and inclusion have been of concern for years, and they didn't just start. And in fact, when we asked the question, did people feel that things are getting better? The response was yes from the majority of people who responded to that particular question. I think secondarily to that question, this work has actually been addressed multiple times over the last 24 years. We know that under the leadership of prior directors of the department who sat in your seat, Kim, that work has actually been addressed. But this time around, it's a little different. I think what we're finding out is that the folks who responded believe that the information that's being gathered points to an internal scan, not necessarily an external scan, right? And so when you ask the question, how long has it been dealt with? I think employees have said themselves for more than 24 years. And I think we've documented efforts to sort of address this internally and externally for the same period. Willard Walker, who's here today, has had an opportunity to deal with some of that. And we've had prior directors prior to Mr. Walker who's done that work. Hopefully that addresses the question.
Thank you. Also, here's another. How might these recommendations impact this community and the institution, which is the City of Lansing, in a way that hasn't been impacted in the past?
Yeah, I think we have to think of this work at multiple levels, structural, systemic, institutional, interpersonal, as well as internalized. And when we think about the history of the work in this community that I'm aware of, there's been a lot of interpersonal work, community work, healing work, dialogue work that we've been engaged in. I believe this initiative has the promise to sort of move that work up to another level into institutional or systemic work. If we're successful in working on ordinance changes and charter changes and thinking about who's hired and employed within the City of Lansing as it relates to our diversity goals and changing the culture within the organization, that will be a step in the right direction to actually influence our institutional and systemic level goals if we follow through with the recommendations that are being proposed.
Thank you. Good question. We have one more question, Dr. Elam, and I just want to remind people that if there aren't any other questions after this one, that Dr. Elam's slides will be made available on the MRJEA webpage, City of Lansing. The last question that I have is, what will be the process for implementation of the recommendations?
That's a great question. So I think what I've offered are recommendations. I think the next step, as recommendation number 9 indicates, is that we need to charge a committee to follow through on the recommendations, to develop an action plan that include what we're calling SMARTY goals. You know, I think some of us have heard SMART goals. They need to be strategic, measurable, ambitious, realistic, and time-bound, but we're adding inclusive and equitable to that, and making sure that we think using an equity lens. We're advocating that we use equity impact assessments as we think about policies and practices and procedures as a new way of doing business within the city. Is this decision going to lead to an equitable outcome? And then I would say lastly, we need to think about our targets for diversity, equity, and inclusion. If you heard a couple points I made, how people feel around these three issues is pretty subjective. And I believe that if the leadership here at the City of Lansing defines where we currently are and where we're trying to work towards, that's something that's measurable around diversity, equity, and inclusion, and shares that transparently with the community and can articulate when we've arrived there, then we'll be working towards a common goal that's not one that's sort of subjective and we're left to define in our own mind. So I opened up by saying right now, 70% of the City of Lansing's workforce is white. And what is the diversity goal for the city in the next year, in the next 3 years, 5 years? And so I think we need to work with the committee to define that, operationalize that, and begin to articulate that, communicate that with the community.
And there appears to be 2 more questions, Dr. Elam. However, I think the next one would be more appropriate if directed to the mayor. And that question is, will City Council have to approve? Mr. Mayor?
I'm sorry, will City Council have to approve what?
Will City Council have to approve this plan?
Well, that's a good question. We will certainly work with our City Council colleagues. It'll depend on what parts of the plan, to be honest with you. If there are ordinance changes, if there are policy changes, it'll depend on what exactly we're doing. City Council will certainly have to approve the creation of the board. We want to create a DEI board, which would be an official city board. Paul had recommended some charter changes and things like that. So that would be City Council and going to the people. But internal policies, creation of department by department policies and things like that are done internally. So we would do that as the administration. So some parts of it will go through council and some parts of it will be implemented through the administration. And then again, if there's anything changing the charter, that would pass, that would be proposed by me, it would pass through council and it would go to the voters to determine.
Thank you, Mayor. And then the last question, and it states, this work is definitely an ongoing process and it will cost. Therefore, what is a reasonable amount of funding that should this administration be prepared to invest in this work? Yes, it is going to cost. And part of Dr. Elam's recommendation is that we budget for it annually. We have submitted a request for $300,000 to begin the work, to begin to build on its foundation. But we're sure that it's going to cost a little bit more each year, perhaps, to the point where we get things where we think it ought to be. But there will be a budget and it is going to cost. Mayor, did you want to add anything to that?
You're muted.
You are muted.
Sorry about that. Yep, we proposed 300,000 in our original budget, which was passed, and that will need to be still considered by council. That was set aside to be considered. And then council, and maybe we'll get to this later, council has also worked with us to create specific dollars for diversity, for equity, for external groups. So we've got the 300,000 that is set for this plan and implementation of this plan. We'll have to again create the board that Paul had recommended, and then we'll also have dollars to give to external groups, which I think you're going to get to shortly.
Very good, very good. And we will do just one more question, and it says, great report, Dr. Elam. My question is, will steps be put in place to assess and/or adjust if necessary, if implemented? Also, what is the recourse or accountability for leadership? Let's try it again. Great report, Dr. Elam. My question is, Will steps be put in place to assess or adjust if necessary, if implemented?
Yes, and I think the intent of the recommendations, as the mayor alluded to, is to make sure that a board is put in place, which a part of the role would be to provide oversight, accountability, and to approve the action plans that would be developed by the diverse team that would work within the city. And so I think if we move forward with that, that function would be put in place. There would be a governance, there would be staff allocated, and then if we're successful in getting the 300,000 approved this year, resources would be provided, and then we would do the work with the ordinance to make sure that a percentage of the city's budget would be available annually to continue this work. And so that is our intent, that is our hope, and that is why those recommendations are being offered to think about the sustainability of the work.
Thank you, Dr. Elam, for sharing this important information. And know that we can't thank you enough for your support, your time, and your expertise as it relates to this initiative.
It's my pleasure.
Absolutely. Information from the internal scan, along with information from the community and the MRJEA committees, have informed the results of the MRJEA report. Chief Green will now launch our discussion this evening regarding the external scan by sharing with you an overview of the input we received from the electronic external scan and the focus groups that were conducted as a part of this process. As you well know, Chief Green will be retiring effective Thursday, June 24th, and has committed to continuing to provide support to the incoming interim chief, Ellery Soulsby, regarding this important work. We will now hear from Chief Green.
Good evening, and thank you very much, Dr. Coleman. And again, great report, Dr. Elam. Very appreciative of that report. The objectives of the external survey are consistent with other such surveys. We sought to gather insight from a large and broad audience throughout the community of concern. Our overarching objective and goals were to produce an external assessment to gauge understanding of the quality of life for those that live, work, and visit the city of Lansing. We further evaluated what the public thought about the quality of some city services, focusing heavily on public safety, which is really the impetus for our current work. Overall, we tried to ask questions about the thoughts of racial equity in our communities. Next slide, please. The following online survey was open for approximately 1 year, with the majority of the responses completed during the time frame of August through October of 2020. 70% of the survey was completed during that time frame. The sample demonstrated 25% BIPOC and 75% Caucasian, and was largely a female heterosexual group that earned more than $41,000 a year, had a bachelor's degree, and are homeowners. 63% of those sampled were residents of the city of Lansing, and age was almost evenly split, with only 3% of the sample listed themselves as an immigrant. Next slide, please. Questions of crime demonstrated that 52% of the sample reported that they were victims of a crime. 53% stated that the city of Lansing has a moderate level of crime. Over 57% reported that their lives were impacted by crime, and 78% had taken steps to protect themselves and their family from crime, with 47% of the sample mentioning they had a firearm for their protection. Next slide, please. 51% of the sample stated satisfaction with the performance of LPD, Lansing Police Department, and 70% favored community policing as a policing practice. We did not specify the definition of community policing, so it's unclear exactly what the sample group would like to observe in a community police officer. On the issue of traffic stops, 34% stated that they had been stopped by LPD, and they felt that they were treated fairly during that stop. 8% said that they were not treated fairly, and 58% remarked that they had not been stopped by LPD. Notably, the stops did not specify a traffic stop or other contact with police during an investigation. Next slide. It was clear that the sample audience thought that LPD treated people differently because of race, over 100%. When asked how to achieve equity at LPD, holding officers accountable who violate policies was the most significant variable to achieve equity at LPD. The sample further supported having more community meetings and policy changes that are more equitable. 47% supported new traffic stop guidelines that were designed to lessen stops for defective equipment violations. 20% were unsure of those new guidelines and the impact in the community. There was significant support for the policy change of not supporting no-knock warrants, and over 66% wanted to see more police policy reforms. There was also supported information that was needed to sustain the notion that trained health professionals are viable for police calls for services that do not involve criminal activity. Next slide. Over 82% reported they felt comfortable living, visiting, or working in the city of Lansing. 23% stated they did not believe the city of Lansing hires and support people of color to work for the city of Lansing. Only 5% stated they had been forced out of a job because of racism in the city of Lansing. 41% articulated that their employment has a DEI officer, and the majority commented that their workplace addresses issues of racism, and that was 54%. Most persons thought that racism is still a problem in Lansing, and they were split on whether there was an issue in the area of arts and culture in the city, whereas 53 and 51% argued that racism was a problem in education and healthcare throughout the Lansing area. Racism was found significantly similar for housing and the jobs and economic sectors, including public safety and in the areas of neighborhoods. Our findings supported the notion that racism is a concern for our community, the city of Lansing, and the public safety sector. Most persons believe that we should engage in more systems to hold officers accountable for policy violations. There's further support for policy reform specific to policing, and the data also supports continued racial equity work in the city of Lansing in almost all aspects of our society. Finally, there's support for creating permanent racial equity work in the city of Lansing. And that includes my report. Thank you very much.
Thank you, Chief Green. And I just want to say to you, Chief Green, we appreciate the knowledge, the wisdom that you've shared, the strength that you've brought to this process. We will miss you greatly, and we look forward to your continued support. And on a personal note, it was indeed an honor to co-chair this racial justice and equity process with you, and I thank you for the opportunity.
Thank you as well. It was truly an honor for me and a work of a lifetime. Thank you very much.
Absolutely. We will now hear from Guadalupe Ayala, the city's Diversity, Equity, and Inclusion Officer, regarding the highlights from the MRJEA committees. Guadalupe.
Thank you, Director Coleman, and good evening, Lansing. It is a pleasure to be here with you all today and present the work of the MRJEA committees. And I will be going over the issues each work group identified from their review of outcomes from focus groups in the community, the survey that Chief Green just shared with us, and the work group's own scans in the community. So to kick it off, we'll do the Communities and Neighborhoods Committee, which was co-chaired by Laurel Baltimore and Calvin Jones. Members included Kimberly Coleman, Ronald Embry, Jonathan Rosewood, Randy Watkins, and Delisa Fountain. The issues identified were as follows. First, racism. And as in the survey that Chief shared, 50% of residents feel that racism is a problem in Lansing and neighborhoods and the community as a whole. Residents also raised concerns about racism as it relates to public safety, education, housing, and healthcare. Lack of communication was the second issue identified, where there is a distinct need for open, transparent, two-way communication between the city, various city groups, and the neighborhoods. It is only through open communication that residents can learn of the various events and opportunities available to them. So with the two issues identified, the committee was able to put together 6 goals. The first one is to analyze and assess comments pertaining to racism in the Lansing community and neighborhoods to obtain a better understanding of those reasons. Second, to develop a strategic plan for engagement and outreach in the communities and neighborhoods. Third, to develop a strategy for collaborative citizen engagement on projects and programs to broaden the city's understanding of neighborhood problems and collaborative opportunities, which include beautification projects and addressing accessibility issues, specifically focused on crosswalks at grocery stores, public restrooms, and shopping malls. Fourth is to analyze the homeless situation in the city and develop strategies to reduce the homelessness rate. Fifth, to examine models for engagement and inclusion in the city for all age groups, but particularly millennials. And lastly, to examine community problem solving with a buy-in with business owners. Moving on to health and environmental justice, the committee consisted with co-chairs Dr. Lakia Tucker and Linda Vale. Members included Dr. Farhan Badi, Dr. Renee Kennedy, Brian Crenshaw, Dr. Fariha Nas, Felice Rodriguez, Karen Tate, and Teresa Bigman. The Health and Environmental Justice Work Group identified 4 issues. First one being health and housing, specific to lead education, the lack of community awareness of health-related resources, and the need to improve collaboration and cooperation between the mayor's office and the Ingham County Health Department's Health Improvement Plan. And lastly, to the access to healthy foods. They identified 4 goals. First one in health and housing, to educate residents and landlords about lead and paint and elsewhere in the homes. And in determining the recommended pilot projects, they review other Michigan city programs and ordinances to ensure the Lansing's ability to implement the best practices in lead mitigation in homes. Second, introduce more community health workers into neighborhoods and the Lansing community as a whole. Community health workers are uniquely positioned to build trust and address barriers experienced by traditionally underserved communities when seeking medical care and services within the city of Lansing. Third, to build a strong structured collaboration between the mayor's office and the Ingham County Health Department's Community Health Improvement Plan, known as CHIP, to assist in overseeing the recommendations of the Mayor's Racial Justice and Equity Alliance. And fourth, in order to improve access to healthy foods, that is a need in order to reduce food insecurity. Our next work group is the Arts and Culture Work Group, chaired by Trustee Angela Matthews and Lorenzo Lopez. Members included myself, Mr. Dion Gladney, Valerie Marchand, Megan Martin, and Clara Martinez. So the 2 issues identified by the work group were that festivals and cultural events within the Lansing do not reflect the diversity of the city, and BIPOC and the LGBT communities do not have sufficient access to art funding and funding opportunities. Therefore, the work group decided to focus on one goal, which is bringing together under one umbrella a clearinghouse for events, workshops, art exhibits, festival, concerts, etc., as well as access to grants and assistance with the grant process to enable all in Lansing to have equal access to community, cultural, and art events. This will allow them to explore events taking place outside of their neighborhoods. Moving on to the Education and Youth Development Work Group, chaired by Dr. Delsa Chapman and Carmen Turner. which members included Brenda Henderson, Jakia Murphy, Bishop Alfred B. Singleton, and Linda Sanchez Gasella. They identify 4 issues. First one being racism within the community and specifically the public and charter school settings. Second, violence within the neighborhoods and local proprietorships. Third, lack of community-based after-school programs that target at-risk youth. And lastly, the mass unemployment. They identified 3 goals. The first one is to partner with local education and community organizations to broaden opportunities for Lansing youth in the areas of high school completion, post-secondary scholarships, internships, and financial acquisition for college and trade schools. Second, to expand programming at community centers that address the whole child and provide education to parents and caregivers through Lansing School District's parent university. Third, to collaborate with Lansing School District to embed social emotional learning, restorative justice, and college and career readiness programs into youth development initiatives led by the City of Lansing. Moving on to the Criminal Justice and Public Safety Committee, chaired by Pamela Davies and Reverend Dr. Melvin Jones. Members included Del Kopich, Reverend Stanley Jenkins, Chief Darrell Green, and Chief Grant Martin. They identify the following issues. Consistent with President Obama's 21st Century Policing Task Force, the Public Safety Work Group identified these 6 pillars of policing objectives as issues that should be addressed in the Lansing policing policy. First, building trust and legitimacy, policy and oversight, community policing and crime reduction, officer training and education, officer safety and wellness, technology and social media. They identify 5 goals to target these issues. First one being to improve police accountability via an early intervention program to promote best police practices, identifying and correcting problematic officer performance. Second, to improve police transparency, especially as it relates to policies, procedures, and disciplinary actions. Third, the City of Lansing police officers understand how to appropriately de-escalate a situation based on solid policies and embedded on ongoing training. So no use of force is the goal at every call for service. Fourth, to improve training for officers and for the public, officer training should specifically address profiling, and public education should be focused on appropriate interactions with law enforcement, especially during traffic stops. And finally, police and fire departments that reflect the demographics and cultural values of the community and are more engaged in community efforts. Moving on to jobs and economic development, co-chaired by Carl Dorshemer and Dr. Elaine Laws Barker. Members included Mr. Burton Brown, Del Kopich, Travis Harris, Hannah Bryant, Tony Willis, and Teresa Bigman. The Jobs and Economic Development Work Group identified the 3 issues. Lansing small businesses with BIPOC ownership have been hit especially hard with the pandemic, and they're also less likely to have received funding from one or more recent state and federally funded businesses rescue and restart grant programs. 2, the percent of Lansing entrepreneurs starting new business and staying in business more than 5 years is much lower than that of the startup business overall. And also existing BIPOC businesses are often at a disadvantage from lack of financing and proper ownership, structure, and economies of scale where purchasing supplies for their business. Lastly, there are many employers in Lansing with unfilled quality jobs offering high pay and benefits. And at the same time, there are many BIPOC job seekers who with some additional training and/or education could qualify and be hired into these quality jobs. So with these issues, they identify 5 goals. First one being to continue to aid small businesses in Lansing to enable them to survive the pandemic and recover as the economy rebounds. Second is to increase successful entrepreneurship and small business ownership among low-income people and communities that are primarily Black, Indigenous, and people of color. Third, increase job training and educational opportunities for low-income people, in communities that are primarily BIPOC city residents to increase incomes and to create better career paths for youth. Fourth, the City of Lansing communities of color equitably benefit from hiring and employment opportunities within the city and for the city. Finally, cities, communities of color equitably benefit in the economic prosperity of the city. And our last work group is Housing and Development, chaired by Susan Crankrow and Joel Ferguson and Brian McGrain. Members included Gregory Eaton and Mr. Willard Walker. They identified the following issues. First one being a need for a plan and designated resources to gather data. Data specific to Lansing is in short supply when it comes to identifying housing opportunities and barriers. Two, a need for a process and resources for evaluation. And our housing, the question is, are housing programs available fairly to all? And are they achieving what they were designed for and what they need to achieve? Third, a need for resources as stated above, but also for better maintenance of housing. So whether rental or owner occupied, and for increasing the available supply. And lastly, a need for education, specifically more programs that provide education and a better way of conducting marketing and outreach, specifically towards communities of color. So with these issues identified, they have the following goals. First one, to ensure people of color in Lansing have access to affordable housing. Second, to keep good landlords and developers in business within the city to ensure availability of quality affordable housing. And lastly, to evaluate existing housing programs, mortgage data, et cetera, to have a better understanding of who is being reached and how they are accessing housing. So any questions or comments, please share them in the chat box, through email, or calling our office. Thank you all for your time. And as stated, work groups have set goals based on the issues they have identified, and they have recommendations for the mayor on how to achieve these goals for our city. Again, thank you for your time, and Director Coleman will now facilitate a discussion with the MRJEA work group co-chairs. Thank you.
Thank you, Guadalupe. Just so you know, in addition to Dr. Elam's presentation, you will also find online a new strategy document that we will release on tomorrow that will allow you information with regard to the recommendations related to the issues and goals identified by each committee. We will now bring chairs of the Mayor's Racial Justice and Equity Alliance committees to the screen for a panel discussion. Please type your questions for the committee chairs in the chat box. You may also include questions for Chief Green and for Guadalupe. Before we get into the questions and responding to the questions, please, you go ahead and put yours in the chat box. But I'd also like to ask each of the committees to give you an idea, a synopsis, one or two of their top recommendations from their committee. And I'll just go through a brief list of, I think it's 6 that will be responding. And so we'll start with communities and neighborhoods. Kelvin Jones. 1 or 2 top recommendations that you might have in the overall plan for communities and neighborhoods.
This is Laurel Baltimore, and one of the recommendations that we had was to develop a equity center standards for training and community engagement, and with the hopes of improving the relationship with neighborhood leaders and city officials in community engagement. We do think that one of the things that will be occurring that we are aware of is a Citizens Engagement Academy, which will be a 11-week course engagement where participants will meet and have an opportunity to engage and learn more about the role the city plays in their everyday lives, and will learn more about the process of city government and how residents can impact the decisions made within within each department. So that was one of our major recommendations, and we do see that making some progress.
Awesome. Thank you, Laurel. If we can have all of the committee chairs turn on their video. The next committee, how about Jobs and Economic Development? Please share one or two of your top recommendations.
Good evening. One of our top recommendations was to increase successful entrepreneurship and small business ownership among BIPOC communities. We believe that business ownership is the key to changing the outcome in a community. Our recommendations and steps included providing more assistance and opportunities for businesses to do business with the City of Lansing, developing a small business mentoring program, creating and encouraging business co-ops so that we could lower the scale and lower costs, and to create equitable small business programs. And we believe that we can have measurables, the number of BIPOC businesses that are created or receive contracts can be immeasurable, and we have leadership opportunities from LEAP, Lansing Economic Development, the City of Lansing itself, the Black Chamber of Commerce, the Hispanic Chamber of Commerce, the Lansing Regional Chamber of Commerce, and the SBDC. And we believe that this is a very attainable goal. Our second recommendation that we felt was very important was to create pathways for jobs and career development. And we thought that this could be a training program that is funded both by private and public sectors, encouraging businesses that are within the Lansing area to develop mentoring and internship opportunity that create a pathway to a greater future for both youth and re-entry programs for adults. We believe that the measurables there include the number of youth that get a job and maintain a successful career path in Lansing, as well as the same type of leadership, the Lansing Regional Chamber, Economic Development, Capital Area Michigan works. So we do believe that the recommendations that we made will be very easy to implement.
Very good. Thank you. How about from communities and neighborhoods? How about jobs and economic development?
Okay. Okay, thank you so much. In my email?
We've already did that one. We just did that one, right? All right, how about education and youth development? Can we get one or two recommendations, top recommendations from you?
Hi, this is Carmen with the Boys and Girls Club. Kim, can you hear me? Can everyone hear me?
Yes.
I apologize, my camera will not come on. It was working fine and then it stopped. But one of our recommendations was looking at expanding after-school program and community-based support initiatives with all Lansing youth. And we've already begun doing that. I've been in contact with the incoming superintendent and already talked about what we have been talking about with this initiative. Our kids deserve not only the opportunity to talk about post-graduation college, but also there's a lot of opportunities when it comes to manufacturing and skilled trades. And so getting with our other after-school programs, just making sure that we're being diligent in our own organizations, listening to our kids and families and not talking to our kids and families, but listening to what they're saying because they do have a lot to say. So instead of talking at, I know the Boys and Girls Club is being very, very conscientious about that, not talking at them, talking to them and understanding what their needs are. Also understanding how we can collaborate better with our other after school and community-based programs to make sure that we are delivering the best for all Lansing kids and not just figuring what's best for our individual organizations. And I think that's been a big issue, and we're really looking to change the narrative when it comes to that. Job readiness, talking about jobs. Job readiness is the key regarding, I think, helping with violence and everything else that goes along with that. So I've already been in touch with the Area Council Manufacturing Council, and we are looking at doing a manufacturing day for families at the Boys and Girls Club, and hopefully other after-school programs in October, because October is Manufacturing Month. So thank you so much.
Thank you, Carmen. Public safety. One or two top recommendations.
Okay, I can go first. One of my favorite recommendations in public safety is one where LPD would adopt a de-escalation policy that put de-escalation as the first response to resistance when circumstances permit. Currently, de-escalation is a response, but not necessarily the first response. And also with that we award the officer somewhat of like the best de-escalator of the year. Okay, so kind of shifting the narrative and shifting the ideas of what the perceptions of law enforcement so that it is a positive one. And by doing that, what would happen? We'd have less harm, less tragedies, and we would increase public safety and public confidence and trust with law enforcement.
Right.
Okay, let me add that due to how racism is structured in our institutions, and I'm speaking in particular of policing and justice, and the collaborative that happens between state, city, and local policing, it does not enable the average citizen to work through that process with any equity. And my favorite recommendation, of course, has to do with a citizens review process that enables a citizen to have a fair chance at justice in a system that does not seem really to be working in the city of Lansing. I know that there's been several attempts by the city to address the problem, but to the extent that a citizens review process, I think, would bring a lot more equity to a system that has the connotation all over the nation of needing some improvement, and especially here in the city with a number of incidences that we could certainly point out. We need to give citizens an opportunity to equally address their situations through a citizens review process. And that, I think, is a very important issue in this city, and hoping that we can get that done.
Good. Thank you, Pamela and Reverend Jones. How about housing and development? One, maybe two recommendations, top recommendations that you can share tonight.
Susan, your microphone is not working. Still can't hear you.
All right.
Yep. No.
No,
Yes. Yes.
you can hear me now?
Yes.
Okay. All right. Well, sorry about that. The recommendation for our committee to you is two things. Sorry, I'm having, of course, at this moment, traffic in my house. the two things honestly were data. When we went looking into the issue of housing in our area, we saw that we had none of the data that we needed in order to evaluate the need. And we need to have that data. Asking the city to assist maybe with partnerships in obtaining that data is critically important. But my organization, Advent House, is also right now working with over 800 households, 850, who all need assistance with rent and utilities. And in the last couple of months, we've laid out over $2 million to assist households to stay stable and to assist landlords. So I can tell you that right now, with all of these crises going on, anything that we can do to help people to feel more stable, to help them to feel calm and centered in the midst of the crisis that we're still in, is critically important. And if you add to that crises of diversity or lack of diversity and prejudice, then you are talking about a potentially horrendous situation. So we see ourselves looking now again at needing the data in order to go forward, to understand the problem, to evaluate it, and then to appropriately educate the population to use resources so they can be housed stably and securely.
Thank you, Susan. Health and environmental justice. One, maybe two top recommendations.
Hi, Linda Vale. Good to see everybody. I think the two that I will pick are, one is a landlord registration, mostly about lead and lead burdened homes, which we know are, predominantly in our older housing stock in the city and often rental housing. And so when we find children that have elevated blood levels, oftentimes that might be tracked to a particular location. It might even be a rental location, but there's not really a way to have that corrected by the tenant outside of a landlord registration process that requires certain mitigations in terms of the lead. I think that when you look at a landlord registration program related to rental housing, which in the city is typically older rental housing, you could also think about incorporating other things into it, which could help us with basically the conditions under which people live in the city in a lot of that rental housing. The other one that I will mention is the use of what we call community health workers, oftentimes peer support specialists, a variety of different names. There is a Michigan Community Health Worker Alliance, and that helps train and connect folks. But when we hire community health workers, they are peers. It doesn't require that you have a bunch of advanced degrees or anything like that. It requires that you have lived experience that you share with the people that you work with. And so a lot of times with community health workers, what we find, and we're looking at putting community health workers, which we had at one point in time with the fire department, a lot of 911 calls and other emergency calls that come into the city are oftentimes not necessarily something that we need police to respond to, but we need other types of response. And we need people who understand, again, these peers or this lived experience in order to help people through certain barriers, understanding, and I work in one, big bureaucracies that are part of the system of support for people, assistance through Department of Health and Human Services or DHS, assistance through community mental health, assistance through the health department. We're all these giant bureaucracies that are hard to navigate yourselves through. And we don't do that intentionally, but it is true. And so these community health workers kind of get an understanding of the community structures and systems. They help people. We have community health workers that help people with everything from upcoming evictions, getting medications, transportation to appointments, things like that. So implementing some or having some community health workers on board at the city to help with a number of different issues as they occur through the city. So those are the two I will mention.
Thank you, Linda. Arts and culture.
Thank you, Ms. Coleman. I just want to say that arts and culture is absolutely very vital to any community. And it's important when it comes to inclusivity and diversity, because people want to get out, just like you want to get out now. You've been locked up in the pandemic. So now you're looking for things to do and places to go. And so we have to get into this mode of re-socializing ourselves because we have been isolated. And so arts and culture is very, very important. 2 recommendations is that we want to partner with other arts and culture agencies, such as the Lansing Arts Council, that has a lot of information for the community with regards to workshops. We want to partner in that area so that people know how to apply for the funding, when to apply for the funding, so that it doesn't go to the regular sources or the regular persons and or events that it normally goes to, that other people can access those funds. And so those are our recommendations, to partner with what's already set up, as well as to host some workshops so the people who know about this process, that they can be there at those community workshops and they can tell the artist or the community leader, the neighborhood leader, what they need to do in order to access the funds so that they can have their event. Thank you.
Thank you. There are other questions that we won't be able to get to simply because of time, as much as we would like to. It is our intent to answer all questions, so please check our website for responses to any questions that you may have gotten or may have put in the chat that were unanswered. And so we'll need to bring to a close this discussion. Know that we're very, very grateful for the committee chairs and each and every one of you who provided questions and comments and other forms of input. It's our goal to finalize the report by the end of this month. We will share it with each of you, and we'll also share it on the city's website as we begin to implement the plan. So please check the slide that's there or should be there momentarily with the email address, web address, and phone number, and let us hear from you. Now is when the rubber meets the road. Now is when all the work actually comes to reality, and there's a lot of work yet to be done. Your feedback is invaluable, and we do still need you. So please let us hear from you. Anything that you have to offer, please share it with us. And we look forward to the next time. Thank you for your input and your participation. At this time, Mayor Shore will deliver final remarks.
Thank you, Director Coleman. Thank you to everyone involved in the process, to the City of Lansing community, the City of Lansing public servants, the MRJEA, the wonderful, incredible folks who have donated their time and volunteered to help and provide their input. Thanks to Paul Elam and MPHI for the incredible work in their report. Thanks to all of our collaborative partners. And I want to add in my congratulations and thanks to Police Chief Darrell Green as he goes into his retirement. He has been just a tremendous asset to the City of Lansing. I appreciate him. I am happy for him and his family. And he has just been a wonderful, wonderful public servant here in the City of Lansing, getting us through so many crises. I'm very appreciative and exciting for these. I'm very appreciative and excited for these recommendations as we move forward. As we look at our journey over the last year, we acknowledge that this project has been challenging, but it's been enlightening, it's been insightful and fulfilling. I appreciate everyone's hard work and commitment to working together. We're going to create an action plan that will help level the playing field for racial justice and equity in the City of Lansing. We look forward to continuing our work together on our path toward fair and bias-free treatment in Lansing. And I want to thank you all for joining us tonight and just remind you that this is the beginning, not the end. We'll continue to have these discussions. We'll continue to update this plan, and we look forward to its implementation. Thank you, everybody, for being here tonight, and have a great evening.